Hello, and welcome to the American Massage, Chiropractic, and Acupuncture Conference pre-conference broadcast series on One Concept Radio. I'm Felicia Brown, and I'll be your host for this interview and series. This is one of several broadcasts with the presenters and experts who are appearing April 20th through 22nd, 2012 in San Diego, California, and who are brought to you by the One Concept Group. I'd like to take this opportunity to thank the 2012 conference sponsors, Massage Warehouse Script, MPA Media, H.J. Ross, ABMP, and Massage Envy Careers for making this year's event possible. Our special guest today is David Kent. David and I will be talking about his 3-hour class, Back Pain, Breaking the Cycle. But first, let me tell you a little bit about David. David Kent is the president and founder of Kent Health Systems that teaches full-body dissection seminars to massage therapists and acupuncture physicians at the University of South Florida College of Medicine. He also teaches deep tissue medical massage and practice-building seminars and has developed a line of products including the Postural Analysis Grid Chart, Trigger Point Charts, Personalized Essential Office Forms, Muscle Movement Chart, and a series of DVD programs. He has a monthly column in Massage Today called Keeping It Simple that provides treatment and practice-building tips. He is also a regular contributor for Massage Magazine and other leading trade journals on topics from dissection, postural analysis, and trigger points. David, welcome to the American Massage, Chiropractic, and Acupuncture Conference pre-conference broadcast series. As always, I'm excited to talk to you and to learn more about your class, Back Pain, Breaking the Cycle.
Thank you very much, Felicia, and I'm really excited to be here today, and I'd like to thank all of our listeners for their time, and of course the sponsors and the One Concept Group for making events like this interview possible, and for making the Massage, Chiropractic, and Acupuncture Conference possible. So I'm real excited, so let's have some fun today.
Well, we will, and it's not just going to be here today, but also at the conference, as you well know. So, David, before we get into your topic, I wanted to ask you, as a practitioner yourself, why do you recommend that massage, chiropractic, and acupuncture professionals and students attend events like the American Massage, Chiropractic, and Acupuncture Conference?
You know, Felicia, I've got to tell, the listeners, because you're always there, it's the only conference of its kind that embraces, massage therapists, chiropractor, acupuncture professionals under one umbrella. And, we all have similar viewpoints. We treat the body in very much the same way from a wellness point of view. And, I know the One Concept Group has really, they're pioneers in bringing new cost-effective ways for practitioners to get out there, meet the vendors, see, touch, feel, interact with the presenters. And, these are the three professions that come together, and we work together. And you don't even need to be a member to attend. And I've attended conferences all over the world for decades. I can tell you this group does it right. I'm looking forward to being there.
Well, you're absolutely right. It's a fun event, well organized. Very forward-thinking. There's something for everybody from all of the disciplines, and it's just going to be a blast. I can't wait.
Yeah, I'm looking forward to seeing you in person again, seeing a bunch of old friends, doing some networking and, just interacting with the other professions in a place where everyone just, it's a relaxed, fun atmosphere.
It's going to be a lot of fun. So, David, I want to get into your class on back pain, but I'd like for you to just share a little bit about your own personal experience with back pain first. Can you tell me about that?
Well, I've been fortunate because most of my life I didn't experience any back pain, but I've treated it throughout my career. But now I actually had a few experiences, where I had back pain, and then many years ago where I actually had to cancel treatments that I was scheduled to give and actually become the practitioner, become the patient on the table. So it was very enlightening experience, as you know. Once you've been there, it's very insightful.
Oh, for sure. Definitely gives you a lot more sympathy and empathy for people that you're treating.
It does. It does.
So, in your own clinic, what percentage would you say of the clients are actually suffering for back pain? The people that you're treating.
I would say about 30% in my situation. Most of what I see is neck pain, and then right with that is headaches. Now, most people do have back pain. Those people but I'm talking about their primary complaint. I'd say about 30% of my practice is just solely where someone came in with back pain. But you're going to find when they come in with headaches, neck pain, shoulder, knee pain, whatever else, that back's involved as well.
Oh, most definitely. Now, I know that when I've heard you talk before, you have talked about treating the cause versus the symptom of a client's pain. Can you elaborate on that a little bit?
Yeah, there's many different reasons. When someone comes into us with back pain, they could have very specific pain in that muscle. They had some trauma directly there. Maybe there was a direct blow or something like that. But overall, there's many reasons why the person's experiencing pain. Their biomechanics, how they're moving when they're walking or working. Do they have good range of motion in the joints? Because that's going to affect the muscles, or the muscles are affecting the joints. Their posture could be playing a role in what's creating their pain, or all these things are playing a role in what's perpetuating their pain. That posture is going to let us real quickly see what muscles are shortened all the time. They could be having pain, another reason, because there's nerve compression where the bones are pressing on the nerves. We may not be able to specifically always help that situation. There are times where people do need to have surgeries, but they could also have what's called nerve entrapment, where the muscle is squeezing off, or soft tissues of the body are literally squeezing off nerves that are affecting other muscles or organs or other areas of the body. Another reason why someone could have pain is nutritionally, what they're putting in or not putting in their body, and sometimes just their state of mind. So, primarily what we're treating is that myofascial component of their pain. That's what, at least massage therapists, they're treating the myofascial component. The chiropractor, they're treating myofascial as well, but they're also treating the osseous structure or the bones directly with the manipulation, and the massage therapist is supporting those manipulations with massage. So there are many different causes of that, and we need to be able to quickly gather that information from the patient and educate them or help guide them on not only the treatments, but how they can help facilitate the therapies outside of the treatment room.
I know you and I have talked about this at other conferences and in other interviews, but how do you assess what the cause is? When you're trying to get to that, how do you determine what the cause is before you begin your treatment?
Well, I, like you do when you're assessing businesses, you come in and you ask certain questions, and certain ways things should be set up. And when I'm looking at the body, not only am I trying to look at it, but I'm also trying to educate the person. So I take there's many ways that we learn, and three of the ways that I utilize in the treatment room and in the classroom, wherever I am, is a visual, auditory, and kinesthetic way of teaching. So visually and auditorily, I tie it together. Sometimes when someone comes in with pain, I might have them actually draw in the areas on the body where they're experiencing pain. I may visually then show them trigger point patterns that mimic the areas of pain that they're having, so that I can enlighten them on the possibility that we may go find a trigger point during the treatment, and a practitioner can find that regardless of the type of treatment they're doing, whether it's myofascial release or stretching or any massage techniques or any manual techniques. You can be releasing and treating trigger points. And if I'm in the clinic, I use my wall charts, and then if I'm in a mobile situation, at a health fair, or doing chair massage at an event, or educating the public, or just promoting my practice at a health fair, I'll use a flip chart. Another way visually we've talked about, I use technology wherever I can. I'll take a picture with a smartphone and show people what their posture looks like. And many times I'll even video their gait, and just to educate the patient. So I visually show them, I auditorily talk to them, and then kinesthetically we treat them. And if they feel a trigger point, I connect that kinesthetic feeling of that trigger point to the visual picture, and then tie it in with an auditory backup.
And are you going to be explaining how to do those things in your class?
Definitely. Actually, I'm going to show like video of like how I do things. How do I assess people when they come in and they've got headaches and terrible neck pain? I'll show a video of what I've done, what I do with a client that comes in, and or how do I look at their biomechanics when they have back pain. And I walk them down a long hall in the clinic. I've got like a 50-foot long hall, well, it's about 40 feet. And we walk them up and down that hall, and then it's very easily to see what's going on when their gait patterns are maybe they aren't swinging an arm, or they're wobbling to one. They kind of lean. There's reasons why our bodies have so much symmetry in them. Same bones and muscles on each side. We understand that as therapists and practitioners, but our patients don't. But with a little education, they get it very quickly, and they understand that you understand how the body works, and they want to be in the treatment room and follow through at home to get well.
Most definitely. Now, are there any particular causes of back pain that you're going to be covering and learning to treat in your class?
Well, we're going to tap on just about everything that I had already mentioned, to some point. It's a 3-hour class, so we're going to come in there, and like I said, it will be a visual, auditory, and kinesthetic experience in my class. You won't go to sleep, and we'll fill you up with the information. And I'm going to show you examples of how I go through and assess and educate patients and find out, and figure out my treatment plan on the fly based on their symptoms that they're presenting to me. And then at the same time, I'm going to demonstrate treatment techniques so that, we can project that on the screen. Everyone can see some treatment techniques. We're also going to look at the anatomy of certain muscles that are playing roles with certain patterns and holding certain postural patterns. And with those, you're going to see trigger point patterns or pain patterns that are very common, whether it's headaches or back pain. And so I'll show you, hey, here's what I do with basically, almost 90% of my practice, whether it's headaches, neck pain, or back pain, because that's primarily what I see, is how I break it down, how I educate them, how I design a treatment plan, and then how I treat. Now, of course, you're going to have to implement that into your practice. What you take what works for you. Isn't that what we all do? When we go to the classes, we take what's going to work in our practice.
Most definitely. Now, I know it really sounds like when you talk about education that you just enjoy it a lot. In fact, I have to say, for everybody listening, if you haven't been in one of David Kent's classes, you've got to sign up for this. It'll fill up because it's so much fun. He really makes it exciting. It's not, I don't know, I guess my way of looking at it is anybody can teach a boring class. This is not one of them. This is definitely not a boring class. David, you really do make it exciting and interesting. Do you enjoy treating back pain as much as you enjoy teaching people how to treat back pain? And what would you enjoy about it?
Because even when I'm treating, I'm teaching. So I'm always teaching. Even when I'm in the treatment room, I want the people to listen, we all have those patients that come in and they want that basic, they feel they bought the hour of silence, right? Or whatever it is. It's like, fix me. We're all going to have those people that come in and they really don't care. Just do it. And you try to explain and they're not. But, I really get fulfilled in my practice that, you start to attract, I guess, a certain clientele where when they come, I educate them and I show them how to take care of themselves at home and what to do, for themselves. That's what I want as a patient. I don't want to have to constantly go back for the same problem all the time. How can I care for it myself? What's causing it? Because there is a cause, and that's what I try to break down, is educate them and empower them. And you know what? They send you business. They refer their friends because it works. It makes sense. You just gotta point them in the right direction.
Well, I think you're absolutely right. And I was just talking not long ago with another instructor that'll be at the conference, James Wozlowski, and we were talking about the exact same thing, that when you're doing something that really helps your clients, that it makes a difference. Mm-hmm. And especially when you have that attitude of education and caring and sharing, and not just, okay, how many sessions can I cram in today to make a certain dollar amount, but when you're really taking that approach that you're talking about, then it's almost like the marketing builds from that, because people start talking about what a great result they had or how much they appreciated how you were different.
Right, and you see, they don't always understand what is different. And the whole thing is when a patient comes in, I don't know, are they visual, are they auditory, or are they kinesthetic? Now, there are ways of figuring that out based on how they talk and communicate, and there are different ways. But basically, just let's say you don't know and you have no way of identifying that. At least if you go through a process where you're constantly pushing their visual, auditory, and kinesthetic buttons, all three, while you're educating them on whether it's a trigger point, posture, restricted range of motion, what they should be doing for themselves at home, self-care, things like that, as long as you push all three of those buttons, it's more likely that input is something's gonna stick. If that makes sense. We want to make sure that we're doing the things that work best for our patients. And as you start to realize it, you'll know which buttons to push a little bit more for them. Because they'll come in and say, can you tell me more about it? They're auditory. They come in, can you show me more trigger points? They're visual, that type of thing.
Right. And one thing that I really like for people listening, I really like some of the tools that David has created to make creating that process in your office easy, that you can refer to. So you're not trying to flip through an anatomy book necessarily, but that you've got everything right in front of you and you can easily show on a muscle chart what the problem is or what the referring trigger points are creating, how they're creating this pain and that sort of thing. And I think what you said, David, about having a process is really important, because then it makes it easy for you as a practitioner to do the same thing with every person. You have them fill out the same form, you ask them the same list of questions or group of questions depending on their condition, and then you go through the same process of showing the trigger points, doing the video, the picture, etc. That makes it much more, it sounds like a lot when you're saying it, but then it really makes it a lot easier when you're doing it, because the clients and patients are like, oh, they see it, they get it, they understand what you're doing.
And that is how they're educated everywhere else in the world. If you go to the doctor's office, the doctor picks up a little model or they point to a chart. When there's something serious, whether it's the chiropractor or the acupuncture or the cardiologist or the nephrologist, they've got certain charts on the wall. I'm not saying that everyone has to have a clinical setting, but you can have flip charts or whatever to reference, or even have something you're able to carry with you and pull out in any situation. Just show the patient what's taking place and that this isn't a mystery, because, those patients also come in and go, I've been to everyone, I've tried everything, and it's like maybe they have. But many times, people, when I show them this, then they start to say, why hasn't anyone else explained it to me this way? Because, like you said, it makes sense. So we do follow a certain model, And like you say, it's easily modified. And actually, I've broken it down so when you're looking at the wall charts, for example, like the head and neck chart, there's 4 columns. Column 1, all the muscles in the back of the neck, and they're listed superficial to deep. That's the way we all have to treat, whether you're putting an acupuncture needle in, whether you're, going through certain layers of muscle to do a chiropractic adjustment, or whether you're treating it, with your hands or some type of instrument or ultrasound or whatever you're doing. It just makes sense that you'd have that. And then there's another column that just affects the temporal mandibular joint or the face or other muscles in the side or the front of the neck. So it's, I try to make it easy so that someone like myself can quickly access the information in the treatment room, because that's what we all need to do. And then I even color-coded things, so I can't memorize every trigger point that, fires into a specific area of the body, so I color-coded it so I could just quickly circle it with a wet erase marker right there on the chart in front of the patient, educate the patient, refresh myself on the trigger point patterns, because, like I said, I can't memorize them all, so I color-coded them for myself. And then I've got a treatment plan. So I keep it simple. But like you said, it sounds complicated, but it's really simple.
I don't think, well, I've seen it, and, I can't remember anatomy to save my life. That's why I don't teach massage. That's why I teach business and marketing classes. And if I had to stand up and explain where the origin and insertions were of certain things, I would fail miserably as an instructor.
Well, you see, now I can show them that this muscle is so many layers down by just looking down the layer of the chart. Are you with me?
Right.
Whether I'm looking in the neck or the back or anywhere, or the posterior leg, superficial to deep, all the muscles are listed there and shown and displayed. So I'm able to actually communicate to the patient as if this is always on the tip of my tongue, and really it's just a picture right there on the wall that I'm explaining to you. That kind of refreshes my memory quickly at that. There again, keep it simple, but it's really just that simple. We just need to have the visual aid to guide us at times and to educate the patient at the same time.
Right. Well, one thing that you and I have talked about repeatedly is how important it is to set yourself apart as a professional. And this system that you use, or that, whatever system or process people put into place, it's really what you're doing is you are taking steps to set yourself apart. As you said, people are going to come in and say, wow, nobody's ever done this with me before, and that's before you've even done the technique on them to make them feel better. Just showing them the information that they need to know about, the understanding about what got them there, why they're in pain and what they can do to get better is really important. And it's a huge marketing tool, but it's also going to help them to understand why you gave them an exercise in the first place, or why
Correct.
You said you need to come back in this amount of time. So it makes your job easier. And I'm just a big proponent of your systems, David. So. Right.
And when I'm circling the muscles on the back of the neck, when I get to the suboccipitals, I circle and I show them this is the deepest layer. That's why it's at the bottom of this column. And I explain to them that we will we may not even be able to treat this deep today. So subconsciously, I may not have said it to them, but basically what I said to them is, you're going to need to come back for me to treat, because it's true. And we all, we've all had those patients. You can barely touch them, and they're they're going to flinch from you. You just barely put lotion on and stroke the back of their neck. There's no way you're going to treat those deep, there are different ways that you can affect it, but it's going to be challenging. So. And one 30-minute treatment, how these people come in, what's your shortest treatment do you have? Because that's all they need. They've been suffering for 10 weeks already. And, all they want, and they just want the 30-minute treatment, right? We all get that. And you squeeze me in at lunch for 30 minutes.
Exactly. David, in closing, I wanted to just ask you, if you had any particular tips for people who are treating back pain, or perhaps those who have back pain, in lieu of, or I guess prior to coming to your classes, because we've got a couple of months yet. Any suggestions for them?
Well, you know what? One, there's a ton of free information on my website, just so that they know. They can go to davidkent.com or kenthealth.com. It points you to the same place, and I've got a slew of articles there on my website that talk of articles about back pain, many of the topics we've talked about. For example, different trigger point patterns that are tied in with back pain, whether it's the gluteus minimus muscle or gluteus maximus muscle or psoas. There are specific articles about those muscles connected with back pain. There are specific articles that you could watch about or read about with posture, things like that. So lots of communication tips, and there's even video clips that you can watch as well. And anywhere on the web you're going to find a lot of information, but some of the information related to today's discussion and the classes I'll be teaching, definitely look online. Look on my site, please.
Yeah, and there's a lot of great information on there. And David, are the courses that you offer outside of the American Massage, Chiropractic, and Acupuncture Conference, are they listed on there? And
yeah, they are.
The products that you offer?
Yep. They sure are. They sure are.
Great, because I know there's some people that are going to want to come, but they aren't going to be able to make it to San Diego. I mean, it's not an endless size room, so we will have to cap registration at some point, although I know it'll fill up whatever size we have. But I want to make sure that people know they can check out your schedule and get in touch with you.
Please, and if you can't make it to the conference, give us a call, add yourself to our email list so that we're staying in touch with you as well.
I definitely suggest everyone do that. In the meantime, I'd like to tell people how they can register for your class in San Diego and come to the conference. So let me take a minute here to do that. Everyone, the American Massage, Chiropractic, and Acupuncture Conference is one of the largest exhibitions of massage, chiropractic, and acupuncture products, continuing education, and business opportunities for practitioners of all disciplines. This year's conference will feature over 100 exhibitors, continuing education classes of 1 hour, 3 hour, and 1 day workshops, including both of David's 3-hour classes. Other events during the weekend include a free keynote presentation sponsored by ABMP with Dean Juhan, author of Job's Body, a charity golf tournament benefiting the Make-A-Wish Foundation, and the One Concept Gala and Dinner Dance. The registration cost for the general conference is just $40, which includes admission to the trade halls and all 1-hour presentations, participation in raffles and giveaways of literally thousands of dollars in prizes, between class coffee breaks, and loaded goodie bags. Attendees will also have access to many special offers and promotions from the conference exhibitors, as well as the chance to have a fantastic time with friends and colleagues. For students, the conference offers a free student day and Smart from the Start program on Friday, which is sponsored by Massage Warehouse Script and Performance Health. This day is dedicated to massage, chiropractic, and acupuncture students who are currently enrolled in school or who graduate in 2012 and includes a free gift bag for the first 350 people. Also on Friday, all attendees are invited to attend a special presentation, Disciplines Unite, from 12 until 2, and the One Concept Job Fair from 2 to 4. Now, all of this is happening at the Conference Hotel. That's the Town & Country Resort and Conference Center, and I definitely suggest you make plans to stay there if possible. Single or double rates are just $125 a night, but space is limited, so make your reservations now. Also, MPA Media is printing the American Massage, Chiropractic, and Acupuncture Conference Event Program inside all 3 of their magazines, Massage Today, Acupuncture Today, and Dynamic Chiropractic. These will be given out at the conference and distributed to practitioners all over the U.S. That's over 133,000 people. So if you are a vendor or educator who is listening in today and want to get some great exposure for your product or classes, please contact Sandy Pierce with with MPA Media for details on being a part of the conference program. So if you're ready to register for the American Massage, Chiropractic, and Acupuncture Conference, April 20th through 22nd in San Diego, and of course to meet David Kent, myself, and the other amazing presenters, you have two ways to do so. First, you can register online and pick your courses instantly at the official conference websites at www.americanmassageconference.com or americanacupunctureconference.com or americanchiropracticconference.com, depending on your discipline. You may also register by phone. The call is free, and operators are waiting to talk to you. The number is 1-877-674-3504. That's 877-674-3504. We also invite you to stay connected with us on Facebook at facebook.com/American Massage Conference, American Chiropractic Conference, and American Acupuncture Conference. Again, the 2012 American Massage, Chiropractic, and Acupuncture Conference is made possible by all of our wonderful sponsors. Thank you so much to Massage Warehouse Script, MPA Media, H.J. Ross, ABMP, and Massage Envy Careers. I hope after today's broadcast, everyone listening is ready to come to the conference and register for David's class, Back Pain, Breaking the Cycle. David, as always, thank you so much for taking the time to talk with me today and for choosing to be a part of the 2012 American Massage, Chiropractic, and Acupuncture Conference. I'm looking forward to seeing you, and we're really excited to have you at this event.
Hey, Felicia, thank you for having me on the program today. I want to thank our listeners for checking it out. We hope to see you. I want to thank our sponsors, One Concept Group. I hope it's going to be a great time. So if you can make it, be there.
Most definitely. Everyone, this is Felicia Brown, and on behalf of everybody from the American Massage Conference, the American Massage Chiropractic and Acupuncture Conference and One Concept Radio, I want to thank you for tuning into this edition of the pre-conference broadcast series. Please remember to tune in each week through April 16th for more interviews and to visit our websites and Facebook pages for replays of all the interviews in this series. We look forward to seeing you in San Diego in April. Please also consider joining us for the Canadian Massage Conference, November 1st through 3rd in Burlington, Ontario, Canada. Thanks again for tuning in, and have a fabulous day.